one goal of testing to figure out what the diagnosis is and then provide an appropriate treatment for the disease. You want to figure out who these persons' contacts are, test those individuals, figure out who was infected there, and try to halt the spread of an infectious disease that way. And that is what public health folks call contact tracing. For a new disease, I also want to test to figure out how many people in the population actually have the disease. And once I know that can help me understand how contagious this disease is, or what the true mortality rate from the disease would be. How deadly is it? How contagious is it? And so on. And now the last purpose of testing could be where instead of identifying people who are sick, I'm identifying people on the other end of the spectrum, the people who are not sick and who are immune from the disease and cannot spread the disease to others. For COVID, since we do not have an effective treatment yet, just testing sick people so that we can diagnose them doesn't really benefit us because it doesn't change how we treat them. The treatment remains the same, and we're basically treating symptoms rather than the disease or the virus. We don't have a drug that can actually kill the virus right now. COVID is an infectious disease. So if I can test someone who has COVID and then figure out who they had contact with, and I can test all of those individuals, I can reduce the spread of COVID. This is exactly what South Korea did, and they were very successful. But the challenge now in the US is you can only do this at the initial stages of infection. One way to figure out what this disease is about is to test a random sample of the population. So that's basically what I proposed in the Wall Street Journal editorial, that we need to be doing this random sampling, testing a representative sample of the US population to learn about this disease. Right now, what we're doing is we've tested the very sick people, and we have 10,000 confirmed cases. Then among these very sick people, a high fraction of them die. And then we look at that mortality rate and we say, oh my God, this is a really dangerous disease and we got to do something about it. But we don't know that for every confirmed case, how many unconfirmed cases of COVID with mild symptoms are present in the US. Just last week, there was a new test approved under emergency use authorization by the FDA. It tests for COVID antibodies. Antibodies are cells in your immune system that fight viruses and bacteria and so on. If you test positive, that means you have COVID antibodies. Either you had COVID, you had the virus in your body and you recovered from it, or you currently have an active infection. And so what is the advantage of identifying people who are recovered from COVID? Since they are recovered from COVID, they don't have the virus in their body and they're no longer infectious. Since they already have antibodies in their system, they can fight COVID. They are most likely to be immune from COVID. What I'm trying to do in Los Angeles right now, working with the LA County Public Health Department, is to do antibody testing on a representative sample of people in LA County. We're hoping to do it in a couple of weeks. And then we will repeat the test every 2 weeks. And this information is going to be critical for LA County to figure out what to do. Should we continue with stay-at-home orders? Should we do just social distancing? Should we increase the strength of the quarantine? What should we do? That depends really on how many people have these antibodies in the system.